laser surgery and with sarcoma.
Thank you. So I'm talking about a laser specifically for treatment of acne. This is using the 1726 nanometer laser for mild to moderate to severe acne. I don't have any conflict of interest for this talk. So the specific system I'm talking about is a 1726 nanometer laser. It's a 50-watt system. It's a fiber laser. The spot size of this laser is 5 millimeters. It treats in a multi-pulse format, and the important thing is that it uses direct air cooling. It also measures real-time surface temperature, and that's the title of this talk, Treating to Temperature. And it has an aiming beam, which is green in color, and that's 520 nanometers. So, are all the 1726 lasers equal? There are two on the market at the moment. One system, the system I'm talking about, uses air cooling. The other system uses contact cooling. The system with the air cooling is a fiber laser. The other one is a diode laser. The diode laser is more powerful. The pulse duration is shorter. The system with air cooling is 100 milliseconds. And as I said earlier, its principal safety feature is treating to temperature. The other system treats to fluence, and I'll explain why that's important later. So there is no direct studies or clinical comparison between the lasers, but data thus far shows that both lasers give really good clearance at the 12-week mark, so the 3-month mark. And the air cooling system seems to clear the inflammatory lesions more than the contact cooling method. And when we look at long-term remission, so 36 months, 3 years down the track, the air cooling system has a 80% remission with the data thus far. The other system, the remission seems to be less. So as we've discussed in all the various talks, we all know about the various options for treating acne. And of course, isotretinoin is still the mainstay of treatment. The energy-based devices are gaining popularity for patients who don't want medications, or where medications has failed, or for various other reasons. And as we've seen in the earlier talks, there are a whole lot of wavelengths that have been used for acne treatment. The 1064, ND-YAG laser. We saw one with a 1550 laser earlier with good results. And the important thing is that all those lasers work on the principle of beating collateral damage to the sebaceous glands. Some of them do target the water in sebocytes to an extent and destroy some of the sebocytes. This particular wavelength, though, is sebum specific. And the important reason why this laser seems to work is obviously the sebaceous gland is central to the pathogenesis of acne. We also know comedones are important. We also know inflammation is important, but the sebaceous gland is the root cause. And if you look at the slide on your right, sorry, on your left, we can see that the treated area, you can see destruction of the sebocytes. However, the germinal layer of those sebaceous glands, the sebocytes are still there. So the glands aren't totally destroyed, but they are really shrunk down and their activity is decreased. So where does this wavelength come from? This particular wavelength has been developed over numerous years, and the three main investigators who developed this wavelength was, we all know Rox Anderson, Emil Tangeti, and Fernando Sakamoto. And a lot of research went into developing this particular wavelength as it didn't exist before. So if we look at the absorption curve for sebum, which is in the red, the blue and the black lines are the water and melanin absorption curve. And as you can see, the sebum absorption curve peaks at three areas where its absorption coefficient is slightly more than the other two absorption curves of water and melanin. So 1726 sits right in the middle, but there's also 1210 and there's also the 2300. And the reason why this 1726 was chosen, firstly, the 2300 won't go deep enough to hit the sebaceous glands because of its high water absorption. The 1210 won't go deep enough, and also the absorption is not enough. As you can see, it's much lower, closer to 1. So that's why they decided to choose 1726. So it's quite a narrow therapeutic window, but in this computer model, we can see that energy with this wavelength at the skin, most of the energy is absorbed in the epidermis and the dermis, and the red line shows where the sebaceous gland is. So ideally, we need to get the energy there, and then below this, very little energy is absorbed. So those sebaceous glands are at the 1 to 1.5 millimeter depth in your dermis. So the particular system is as a precise thermal management mechanism. And the foundation of this system is using peak epidermal temperature to keep efficacy but patient safety with this treatment. And the system detects your epidermal temperature and tries to keep it at a temperature that is firstly less painful, but will also give you enough heat to target the sebaceous glands. So we can see that this particular system damages the sebaceous glands at all those different levels, from the 4 to 500 microns to 1 millimeter depth, and then to the 1.5 millimeter depth. And that's important because it's those deeper sebaceous glands that the other system tends to struggle at targeting. And this is what this particular slide shows, because the system I'm talking about tends to cover all of those sebaceous glands, and that's probably why the remission is higher than the other system. So the treatment protocol with this system is 4 treatments spaced 1 month apart. And as we can see in the at the 4th treatment, that is, patients can have further treatments, but 4 treatments tends to give you an efficacy close to what we would get with patients who have completed an isotretinoin course. The system has got two modes. It's got a standard mode and it's got a boost mode, and I'll explain why it's got those two modes. So when we look at the response rate after the first treatment, you've got about a 30% improvement in acne. So it's quite a quick improvement. Patients will see it within 4 weeks. And as they continue through the 4 treatments, by the 4th treatment, they've already got about a 70% improvement, and this 4th treatment. So these are some of the results where patients have had, this patient's only had 3 treatments, but you can already see a really good improvement in our acne. Because of the temperature monitoring, this can also be used very, very safely in patients with higher Fitzpatrick skin types, and we can see after 10 months, this patient's acne is still very well controlled. A young man this is after 1 treatment, he's already had a significant improvement in his acne. And here we have a patient who's 3 months follow-up post completing the course, and her acne is still in remission. It can be used off the face and shows very good efficacy as well. So as we can see, it can be used in patients with different Fitzpatrick type skins and really shows efficacy very early on. So where does this 2 treatment modes come from? The standard mode was the original mode that all the studies were done on, and all the evidence came from. But there was one particular problem with the standard mode of this system, which is also a problem in the other system which uses the contact cooling, and that's the pain factor. So treatment with this wavelength at the energy needed to destroy sebaceous glands is an uncomfortable treatment. And if you think about treating our predominant population who has acne, kids, adolescents, none of them want pain. So once all the studies were done, the investigators thought, well, how can we improve that further? And they then developed this boost mode to overcome the problem of the pain. Importantly, both modes still treat to an epidermal temperature. And both modes use 4 treatments, 1 month apart. So if we look at how the different modes work, in the standard mode, each pulse creates an increase in temperature and it keeps going up, and the pain factor also goes up. Whereas in the boost mode, each treatment goes up far more gradually, and in the last mode, it's one sharp spike. So the patient feels a very discomfort and it's gone. Whereas in the other mode, it keeps building and crescendoing. So importantly, with the boost mode, topical anesthesia is sufficient. With the standard mode, you are going to need nerve blocks, topical, cooling, nitrous oxide, everything you can throw at the patient to get them through the treatment. And that's similar with the other system. This is what the treatment screen shows. It shows that you want to treat at a temperature of 43. That's the ideal temperature to be treating at, and the ideal power is 36. That seems to be, those parameters seem to be the most effective. The only thing that needs to change is when you go to areas where you've got very little tissue and bony prominence underneath, the temperature can be turned down to 41, and that's been shown to be just as effective. So after each treatment, the laser gives you a summary, and it tells you your treatment took 44 minutes, which is about right. It is a long treatment. On average, it's about 40 to 45 minutes to complete the treatment of a full face on the patient. I only use the boost mode now because the patients tolerate it very well, and it tells you how many times the laser's fired, and it tells you whether you've maintained that temperature. And if you look at the green line there, it actually shows how well this laser controls that peak epidermal temperature, because you can see that all the pulses are within that green line, so it's very, very specific. And that's because of the feedback that the handpiece can actually detect the patient's, the temperature of the patient's skin. And one important safety feature is if the handpiece detects that the temperature is going too high, it will not fire. This laser only fires if everything is at a safe temperature. So it's very, very safe laser. You can delegate it. Your patients aren't going to have complications. I don't do the treatments myself anymore. All the nursing staff do it, and it is so easy to do. It's literally hold the handpiece, hold your foot on the pedal, and you wait for the laser to fire because it detects everything before it fires. Importantly, there's no visible clinical endpoint. When we're treating, we use a grid that has been designed for the patient's face. Each area, the entire face is gridded out, so it ensures that you treat all the necessary areas, and there are no skip areas when treatment is done, and you avoid undertreating the patient. So the treatment grid ensures that you get bulk cooling, and you're not going to cause any complications. There are two grids that come with this, and it's only the first grid that has 13 millimeters spacing, whereas the grid for the second, third, and fourth treatments has 11.5 millimeters. So it's as I said, it's a green aiming beam, and this laser literally in each square will fire 6 pulses. Each spot size is 4.7, and each dot or line is where the handpiece gets placed on to ensure coverage of the entire area that needs to be treated. I tend to use this method. So as you can see in line 1, you go from left to right, you put the handpiece on each dot, and then in line 2, you put it on each line, and in line 3, you put it on each dot, and then when you go the other way, you make sure so essentially the clinician treating the patient has to make sure they cover each dot and each line. So the endpoints and the downtime is slightly different with the two modes. I tend to only give patients post-treatment information about the boost mode because that's the only mode I'm using at the moment. And patients tend to settle very quickly after completing the treatment. So their downtime is minimal. With the standard mode, the downtime tends to be a bit longer. I always tell my patients that they can have a short-term acne flare after each treatment. Essentially, all the erythema and swelling will settle within a day at most. So who do we use this in? As I said earlier, patients who've had isotretinoin have failed that. They can't tolerate isotretinoin for various reasons. they're planning to have a family quite soon. So women who are not able to take isotretinoin, and patient preference. A lot of patients are still quite sensitive to what they see in the media about isotretinoin causing depression, other issues, and so they come in requesting another option other than isotretinoin. There are some precautions if patients have tattoos in the area, and that's mainly for the body treatments. On the face, patients don't tend to have tattoos, but just to be aware of that, and not to treat over areas where you have open wounds, where patients have manipulated their acne and have got acne excoriae. You might just wait till that settles before starting the treatment. So as I said, the big thing is that this system is a painful this treatment is uncomfortable and can be painful, and with the boost mode, topical anesthesia and cooling suffices. And this is a collage that a very happy patient just sent me just before this talk. She's just completed her 4th treatment, and as you can see, her acne is virtually gone. She was so happy with this. Thank you. Thanks.